Guys, we will be studying about the biomechanics of shoulder complex. Today we will study the acromioclavicular joint and the scapulothoracic joint. Now, acromio and clavicle, as the name suggests, it is a foundation, or it has got two articular surfaces. One is acromion. If you can see the scapula, this is basically the scapula. This is the acromion, and this is a structure which will be this is the articular surface which is attaching with the lateral. This is the, if you can see, this is the clavicle, medial end and the lateral end, and if you see the lateral end, this is the surface. So if I join this with this, you can see this is basically the acromioclavicular joint. Now if you see this structure and this structure, it is hardly joining it. There is no surface which is joining. Can you see that? It is, if I am trying to join this, if you can see this figure, if we try to join this, there is a vertical joint. It is basically a vertical joint. I'll try to show you. It is very difficult to show. Now this is the, if you can see, this is the vertical orientation is there, and this, because of lack of congruence between the surface, it is an unstable joint, because there is a vertical orientation and there is actual no contact between the surface. You will find one part of the surface is not even in contact. So this vertical orientation vary with person to person. It can be somewhere between 14 degree, 6 degree, and it can go up to 30 degree. This variation depends upon the height of a person and the build of a person, and according to that, it being an incongruent joint, it requires various accessory structures, strong accessory structures. Now if you can understand, it is really an incongruent joint, and the motion is very, very difficult, because this is not even, the two surfaces are not even joining. So it is a very kind of a plane synovial joint. It is again a kind of a plane synovial joint, but the congruence of the structures or the articular surface is very less. Now if we have seen the articular surface, it's a plane variety of a synovial joint. The degree of freedom is 3 translatory and 3 rotatory motions. Now here in the 3 translatory motion is the superior, the inferior, the anterior and posterior, the medial and lateral movement at this point. Fine. The rotatory motion which is there is, that is the motion is internal rotation and external rotation, that is with the focus to the glenoid fossa. We take the reference point as glenoid fossa and say that internal rotation and external rotation. Then there is anterior movement of the acromion and superior movement of the inferior part of the scapula, anterior tipping and posterior tipping. The third movement is upward rotation and downward rotation. Can you see how the scapula is moving? So this is the movement of the acromioclavicular joint, because it has been formed by the scapula and the only horizontal bone, that is the clavicle. So what do you understand by this? Now it is a plain kind of a synovial joint. It is very incongruent joint, and because of this incongruency, it depends upon various accessory structures. Now it has got a joint capsule, but it is not as strong as the SC joint capsule. It has got a disc. The width of this fibrocartilage disc depends upon the degree of vertical orientation of the AC joint. That is, it can vary from, as I told you, it can vary somewhere between that 16 degree, and it can go up to, from 6 degrees, it can go up to 30 degrees. So the thickness of the fibrocartilage disc, which makes the two joint congruent, that is, it contact with each other, is with the help of disc. And of course the ligaments. There are very two crucial ligaments. One is the ligament itself, that is the acromioclavicular ligament, the acromion, attaching from the acromion to the clavicle, and another is coricoclavicular ligament. Corico, that is the coronoid process, and to the clavicle. So there will be two kind of a ligaments which play a very crucial role in maintenance or giving congruency or stabilizing this joint, because it has a tendency to dislocate. this AC joint has a tendency to dislocate. When it dislocates, when you are in a close kinematic chain exercises, when you do close kinematic chain exercises of upper limb. So if the forces are not dissipated well, the disc is not in its place, there it has got maximum chances of kind of displacement as well as degeneration. AC joint is very important because it degenerates very easily. Why so? Because it is basically incongruent joint, and if the disc is not in place, if the capsule is, understand, is loose, or the ligament is ruptured, then what will happen is it will dislocate. Fine. Now if you can see, if you cannot see from this, with the image you can see that this is an AC joint. It is formed between the acromion and the clavicle. Fine. And if you can see the ligaments which play a very crucial role is the acromioclavicular ligament, the acromion and the lateral end of the clavicle, and it is they are basically two ligaments over here, the superior and the inferior. The superior acromioclavicular ligament and the inferior acromioclavicular ligament, and you understand the superior and inferior is responsible for preventing the anterior translation. That is the interior movement of the joint. That is, it prevents the interior movement of the lateral end of the clavicle. There is another ligament which is called as between the coronoid process and the clavicle, and this is called as the coricoclavicular ligament, or this has got two parts. It has got conoid ligament and a trapezoid ligament. Conoid ligament, if you can see for yourself, is basically vertically oriented. It is a triangular kind of a red color ligament, where you can see in the red color ligament it is almost how it is oriented is, it is basically medially placed and it is vertically oriented. This trapezoid, as the name itself suggests, it is a quadrangular in shape, yellow in color, and it is horizontally placed. It is horizontally placed. The conoid ligament is basically prevents the posterior translation of the AC joint, whereas the trapezoid prevents the inferior translation of the AC joint. And both of these joints or both of these ligaments prevents the or contract or control the upward rotation of the scapula. Play a very crucial role in controlling the upward rotation of the scapula. Fine. Now I have just briefed you over here. Acromioclavicular ligament, it has got two fibers, superior and inferior. The superior one is stronger than the inferior one. Now what is the function of acromioclavicular joint? It brings together the articular surface of AC joint. It is a site for the insertion of deltoid and trapezium or trapezius aponeurosis, and both these ligaments prevent anterior translation of the joint, that is anterior movement of the lateral end of the clavicle. Fine. The coricoclavicular ligament, it has got two parts, the conoid, that is triangular, vertical and medial, whereas trapezoid is quadrangular, horizontal and lateral. And conoid prevents the inferior translation of the lateral end of the clavicle, whereas trapezoid prevents the posterior translation of the lateral end of the clavicle, and both limit the upward rotation of the scapula. Now if you see for yourself that the AC joint motion, if you see this scapula, this AC joint motion and the orientation of the AC joint from the vertical, it is not in a straight line. So there is some angle, there is something oblique angle in the frontal plane, and this oblique angle causes the oblique alignment of the scapula. That means that it is almost 30 to 40 degree away from the frontal plane, and because of this the movement of AC joint or the AC joint axis is oblique axis, because it lies in the plane of scapula, which is called as scaption. Okay? We will be discussing about it in detail in the later on slides, but let us just understand the scapula is the only bone which is not lying on the thorax like this, but it is oriented something like this. So this orientation of the scapula, it is somewhere 30 to 40 degree in the oblique to the frontal plane. It is not purely in the sagittal or frontal plane, but it is at an angle. So this becomes the plane of scapula, and AC joint motion occurs in the plane of scapula. So what are the motions which occur is It is the internal and external rotation. Now what is internal and external rotation? We take into reference point the glenoid fossa. Now glenoid fossa, when it moves internally, that is the, if I can say, the acromion AC joints move anteriorly or it moves anteromedially. Anterior and medially is called as internal rotation, and when the glenoid fossa moves posteriorly and posteriorly and laterally, that is the AC joint is moving posteriorly and laterally, that is called as the external rotation. Now this motion takes place in vertical axis and transverse plane. Now the second movement which is there is anterior tipping. This is the motion. Now herein you can see the anterior fossa is moving anteriorly and superiorly, whereas AC is also moving anteriorly and superiorly. The inferior portion of the scapula is moving posteriorly. Fine. So this is the anterior tipping. It takes place in sagittal plane and coronal axis, whereas posterior tipping is something like this, when the glenoid fossa is moving posteriorly and there is inward movement or downward movement or anterior movement of the inferior angle of the scapula takes place. Now what is about this rotation? The upward rotation is somewhere like this, where the inferior angle of the scapula, inferior angle is moving outwards and laterally, and the superior or the spine of the scapula is moving medially, whereas the downward rotation is when there is the inferior angle is moving again moving medially and the superior spine of scapula is moving laterally. Fine. So this axis is in frontal plane and AP axis. This movement takes place in frontal plane and the AP axis. Now this movements can be easily shown over here. You can see the upward and the downward rotation. Can you see this? Herein this is the movement where the inferior angle is moving medially and the spine of the scapula is moving the inferior angle is moving laterally and the spine of the scapula is moving medially, whereas downward rotation is when the inferior angle is moving medially and the spine of the scapula is moving laterally. Whereas you can see the anterior and posterior tipping, how the spine, if you can see this is anterior tilt and this is posterior tilt. Anterior tilt and posterior tilt. You can see how the glenoid fossa is moving. It is moving anteriorly as well as posteriorly and superiorly. Whereas this is for the external and internal rotation, where the glenoid fossa is moving internal as well as external movement takes place. Now if you can see this movement in detail, internal and external rotation, the range of motion is 20 to 30 degree, and this movement is basically controlled by acromioclavicular ligament and trapezoid part of the coricoclavicular ligament, and the muscle which is responsible is the trapeze muscle as well as the deltoid muscle. Now if you can see over here, there is another translatory motion also taking place when internal and external rotation takes place. At the AC joint there is anterior and posterior translation also happening. The second is the anterior and posterior tipping. In this tipping, the range of motion is only 20 degree and it is controlled by conoid ligament, and the muscle responsible is pectoralis minor and trapezius. And herein you can see there is a superior and inferior translation. Translatory motion is also happening. You can say whenever there is a anterior and posterior tipping, the intra-articular motion is superior and inferior translation motion takes place. Fine. And the third is upward and downward rotation. The range of motion of upward rotation is 30 degree and the downward rotation is 17 degree, and it is controlled by coricoclavicular ligament. The muscles for the upward rotation is serratus anterior and trapeze, whereas downward is levator scapulae and latissimus dorsi, rhomboids and pectoralis minor. And herein you can see the translatory motion is medial and lateral translatory motion takes place at the AC joint. I hope so this is clear. Now let us go to the scapulothoracic joint. Now the scapulothoracic joint is not an anatomical joint, but it is a true functional joint. Now if you can see, this is the scapula, and the scapula is lying on the thorax, that is the ribs, and it is lying on this joint. It is basically, there is no articular surface here. because it is not lying on the thorax, it is it is lying on the soft tissue structure, but the movement, so it is dependent on the SC and the AC joint for the movement. So that means no pure movement can be possible in scapula unless and until it is functionally linked with the AC and the SC joint. So we say that it is structurally and functionally linked with the AC and SC joint, so it becomes a true closed chain joint. It is a true closed chain joint, and it is articulation is scapula is lying on the thorax. You can see over here the scapula is lying on the thorax, and this is the scapulothoracic joint. There is no articular surfaces over here. Now this, if you can see, now the resting position of scapula is very much important. The word which I introduced was the plane of scaption, which will be very much clear with this. Now it is 30 to 45 degree away from the frontal plane. It is 30 to 45 degree away from the frontal plane. It is 5 centimeter from the midline of the body. It continues from the second rib to the 7th rib. It is 10 to 20 degree oriented from the vertical in lateral view, and its posterior side of the scapula is upward rotated 5 to 10 degree. Now to make you understand this, you can see this in coronal plane. If this is the orientation of the scapula, ideally the plane should be like this, it should lie like this, but it is not lying like this. Why so? Because the rib is rotated, the ribs are rotated, ribs are not straight. So you can see if this rib is rotated, the scapula is running on those ribs. So it is 30 to 45 degree away in the frontal or the coronal plane. Fine. Now herein you see it is also rotated. Now it is 5 centimeter away from the midline of, when you take the midline from the spine, it is 5 centimeter away. It lies somewhere between the second rib and the 7th rib, and it is not vertical. That means it is not lying like this, it is lying something like this. That is from the vertical, it is 5 to 10 degree away. Now herein there is anterior 10 to 20 degree tilted. Now it is not straight, it is again tilted because it is trying to take the curvature of the thorax or curvature of the ribs. So it is anterior 10 to 20 degrees, anterior tilted is there. So now this is clear. Now if we will read this again, it is 30 to 45 degree away from the frontal plane, 5 centimeter from the midline of the body, continues from the 2nd to 7th rib, 10 to 20 degree. It is anterior tilt, and the posterior side of the scapula is upward rotated 5 to 10 degree. It was not this, it was upward rotated to 5 to 10 degree. Now these points are clear. Now this is called as the resting position of scapula or the plane of scaption. Or the plane of scaption. The AC joint motion was oblique, was having an oblique axis because it was working on the axis of or on the plane of scapula. It was working on the plane of scapula. Therefore, the axis was oblique. Fine. Now these are the motion. Now SC joint motion is similar to the AC joint motion. And if you can see, the acromion process and the or the AC joint acromion process is a part of scapula. So all the motion which was there in the AC joints happens at the ST joint. The ST joint is acting. It is not a it is not a true joint because it is structurally attached to the SC and the AC joint. It is structurally attached. Therefore, all the motion at the AC joint will happen at the ST joint also. So what are these motions? Rotatory motions, but it has got primary motion, upward and downward rotation. That means it is upward. If it is, this is the motion, this is upward and downward rotation. Upward and downward rotation is the primary motion, whereas internal and external rotation and anterior and posterior tilt is the secondary motion. The other translatory motion is elevation, depression, that which takes place along with the anterior and posterior tilt. There is elevation and depression, that is the scapula will move on the thorax upwards or downwards, and with protraction and retraction there is adduction and abduction of the scapula also takes place. So that is, these are the two vertical movements, the vertical as well as horizontal movements which are translatory motions which are possible at the ST joints. Now we will study about it. There is an upward rotation of the scapula and which is 50 to 60 degree. You can see the upward rotation. Now if you can define the upward rotation as, it is the, again I will define this, keeping an orientation or keeping a reference point as the glenoid fossa. The upward rotation is when the glenoid fossa moves upwards and superiorly, the inferior part of the clavicle moves laterally and the spine or the superior angle of the scapula moves medially. Fine. So this is what is upward rotation of scapula means. Now this upward rotation of the scapula is caused by upper trapeze, lower trapeze and serratus anterior muscle. Now if this kind of a movement takes place at ST joint, similar movement is taking place at the AC joint also. AC joint is also performing the same movement, upward and downward rotation movement. Now what happens at the SC joints? The SC joint, there are two movements which are happening here. One is the anterior posterior rotation and elevation and depression. The interior posterior rotation and you can see the interior posterior rotation. Now what is happening here is there is anterior and posterior rotation as well as the elevation and depression. Elevation and depression which is happening. It is very difficult to show you over here since I don't have a proper skeletal, but I'll try to show you. Now if this is the joint, you can see whenever there is an upward rotation, the upward rotation is taking place. It is also causing the upward rotation of AC joint. The AC joint is also moving upwards. But what is happening at this point? What is happening at the SC joint is it is causing an rotational movement, because this movement is causing a rotational movement. There is a rotation of the clavicle which is happening at the medial end. The rotation of the clavicle is happening as well as there is some kind of a, you can see, elevation. Rotation of the clavicle along with the elevation. So the anterior and posterior rotation takes place, 2/3 is the motion of anterior and posterior rotation and only 1/3 motion is elevation. So let's see this again. If this is the movement which is happening, so what is happening is with this motion, you can see this is also moving. This is the rotational motion, and if this is the rotational motion, then what is happening is that it is basically the lateral end of the clavicle is also elevating and moving. But what is happening here is the clavicle is also rotating, because the surface you can see is almost vertical. The orientation is totally vertical, so it need to make it congruent. There is rotation of the rotation at the SC joint is taking place. Now with anterior and posterior tipping, now what will happen in case if there is an anterior and posterior tipping? Now this is the anterior tipping, this is the posterior tipping. Now in anterior posterior tipping, it is brought about by at SC joint an elevation and depression movement. Elevation and depression movement. And what happens in internal and external rotation? In internal and external rotation, you can see this is followed by protraction and retraction at SC joint. It is followed by protraction and retraction by SC joint. So this is the integrated motion of SC, AC and ST joint. Now let us repeat this again and read this again. The ST joint is when there is an upward primary motion, upward and downward motion is taking place. AC joint will follow the same motion, upward and downward rotation, because they both are working at the plane of scapula. Whereas at SC joint, there will be two motion. One primary motion is anterior posterior rotation and the secondary motion is elevation and depression. The second movement is anterior posterior tilting at the ST joint, where AC joint also follows the ST joint here. There is also anterior posterior tilting, but at SC joint there is elevation and depression takes place. And when there is an internal and external rotation at ST joint, the internal rotation and external rotation also takes place at AC joint, but there is protraction and retraction which takes place at the SC joint. It is protraction and retraction. One has to keep in mind internal and external rotation is change, range of motion changes when the person is having winging of scapula. Fine. There is translatory motion also. I wanted to show how this translatory motion takes place. There are two motion, as I told you, the upward vertical motion, upward and downward motion, and the scapula adduction and abduction motion. Now you can see when the elevation is taking place and there is a rotatory motion, then there is also an upward movement of the scapula and the downward. That is, when with elevation there is an upward movement as well as the downward movement of the scapula taking place. Fine. And what is happening at the protraction and retraction? There is adduction and abduction. With this protraction movement, you can see the scapula is basically going for abduction, and when the retraction movement, the scapula is going for the adduction. Fine. Now, today we basically summarized the integrated motion of SC, AC and ST joint. Now, when we understand this motion, SC, AC and ST joint, we will be able to understand very important topic which I will be taking in my next class about scapulohumeral rhythm. Fine. And if you understand or go with this topic, you will be able to understand the next topic as the scapulohumeral, the role of glenohumeral joint and the scapula. Fine. So I hope you understand this topic, and if you have any queries, please message me so that I can clear your doubts. Thank you.